Tonight's Health Edge, taking aspirin daily to prevent heart attacks. New guidelines just released for certain adults.
Dr. Nandi joins us now with details on this. A lot of people taking daily doses of
Exactly.
aspirin.
But really important. New guidelines are recommending that people in their 50s to take 81 milligrams of aspirin every day to prevent heart attacks or stroke. The U.S. Preventative Task Force says it's for those who've never had a heart attack or stroke and have risk factors for heart disease such as high blood pressure, high cholesterol, or a history of smoking. So important to know which ones people need to take those.
Now, Doc, how does the aspirin work in this daily? Because I understand it can be hard on the stomach.
Exactly. And so in this situation, what aspirin does is prevents blood cells called platelets from sticking together and clogging arteries. Heart disease is the #1 cause of death in the United States. So many people need to make lifestyle changes. So here are my prescriptions for heart attack prevention. So first, begin early. Many first heart attacks or strokes are fatal or disabling, so prevention is critical. The sooner you begin taking care of yourself, the longer and stronger your heart will be. Also, know the controllable risk factors that you can control, such as smoking, maintaining a healthy weight, getting exercise, and having a low blood pressure and cholesterol. Know your numbers, folks. Also know the uncontrollable risk factors. These are the ones that are not in your control, like your race, being male, having a family history of heart disease, or being postmenopausal. And finally, we talk about this all the time, understand nutrition. Make the right food choices, including lean proteins, fruits, veggies, and whole grains, all important to prevent heart disease.
So what about the risk factors for taking an aspirin every single day?
And Glenn alluded to that. So one of the things is that aspirin can cause bleeding in the stomach and the brain. So if you have a bleeding disorder, you should probably not take it. I'd recommend talking to your doctor first. Make sure you're a good candidate so you're not at risk for any side effects before taking this drug.
All right, Doc, before we go, we do have a viewer question, and they're taking iron supplements and have diarrhea. What other side effects do iron supplements have now?
So here's the problem, and it's a great question. So people have so many side effects from iron, they don't want to take it. You can get constipated, nausea, your stools can be abnormal, and it can be dark. So what I say is stick with it. There are some formulations that are slow in absorption, that may help. You can also have others that basically are different, that basically say it's a different formula, like Niforex or slow FE. But the bottom line is that please take it, because if you don't, you can become anemic, and if you're anemic, your body doesn't have the energy it needs. And then talk to your doctor. There may be other tricks you can have to beat the side effects of iron. Okay. Also, last thing is that you can have foods such as meat. Red meat is a great source of absorbable iron. So instead of just the pills, do that as well.
And real quickly before we go, going back to the aspirin, should we be taking a baby aspirin or regular aspirin?
And they're talking about a baby aspirin because 81 milligrams of baby aspirin, that has less side effects and can give you just as much of protection. Some people need the full aspirin, but most people can do the baby aspirin.
That is the 81 milligrams.
That's exactly
so we do
right.
have to remember that.
That's exactly right.
And in a heart attack, you can grab one too, right?
That's exactly right.
All right.
And then you would take a full aspirin at that time.
Thank you, Doc.
Yeah, absolutely.
All right. If you have a question or a health concern for the doctor, you can email him at drnandy@WXYZ.com or send it to us on Facebook or Twitter.